right, welcome in April 30th. New Friday safety focus of the week. Let's quickly start up. As you can see, we've had a pretty good month of April when it comes to COVID. We're kind of hitting a nice little downhill here, and we're dropped down to a 1% 7-day average. So we're really starting to, the vaccines are really starting to do its job, and we're starting to really see this virus really start to get under control, which is excellent. I did see on the vaccine dashboard that we're about 60% of Vermonters have had the vaccine. So that's probably a little bit correlation of how we have such good numbers. So I think we're on a pretty good track to all those milestones that we've been hearing about in the news. So with that said, I'm gonna kick it over to this week's code of conduct is don't overpromise or underdeliver. Ben, do you have anything you'd like to add on this code item this week?
I think this one speaks for itself. The big thing is if you're going to be late for a meeting with someone else, just let them know and don't try to speed and create a safety hazard.
Well said. So this week, another 7 days without a recordable injury. So excellent job. Looks like hopefully let's get through today and we'll get through the month of April without an incident. So let's keep up the good work. Remember that biggest part of safety is that pre-planning side of it, is making sure you have the right tool for the job, the right safety measures in place regarding fall protection, trench safety, work zones, all those major hazards to identify them and eliminate those unsafe conditions and unsafe acts. And hopefully we can continue to keep this excellent safety record going throughout the 2021 season. This week, we're going to just highlight our new COVID protocols that Ken will speak about a little bit later in the email where they can be located, but we're going to just kind of do a little awareness, a little refresher, and what is some minor adjustments that are in our protocols moving forward as we're seeing things start getting lifted a little bit. So one of the biggest things that we need to try to remember, and it's a little bit new this construction season versus last, is there is directive now from OSHA and VOSHA to issue out citations regarding coronavirus and unsafe workplace regarding to the virus. So one of the biggest things is with all the plan and the standards that are out there, the emergency standards that are out there that we have to follow is each organization needs to have a CSRO. And I'm going to be the CSRO, the COVID Safety Resource Officer for the whole entire company. And we're going to rely on the foreman to kind of be the on-site CSROs that we've got trained last year. Just biggest thing is it's that chain of command, not really chain of command, it's a chain of communication. So if something happens or someone's not feeling well on site, we know exactly who to call and how to handle it and how to kind of trigger this program. So we're just following best practices. The new plan that we established is going to be on Ken's email, but also I put it on the foreman and supervisors teams channel, and it's under files. You'll see it located there. So biggest thing, again, is that health screening. Currently, the coronavirus is not in our organization. We don't have any active cases. However, it could change in a matter of seconds. So it's very important that we continue with the health screening, staying home if ill. If someone in your household or if you are aware of a close contact, please call health and safety so that we can kind of trigger the best practices according to our protocols. Remember social distancing. Again, it's a great way to mitigate the virus is continue to follow the best practices, and social distancing is one of our key elements. Hand hygiene, again, practice good hand hygiene. Wash your hands frequently with warm soap and water, and if you can't, again, hand sanitizer is available in the tool crib. So make sure our projects are stocked up so individuals can kind of wash their hands before they eat and after kind of touching commonly touched surfaces. Facial coverings is another key element of the program. So again, continue to wear your facial coverings indoors and outdoors when social distancing of 6 feet cannot be maintained. So again, that's That's that trigger, is that social distancing, when we have to work close to one another or be kind of in a crowded area to wear those wear those facial coverings. Cleaning and disinfecting is one of our other key components to the program. So continue cleaning and disinfecting commonly touched surface as much as possible, especially frequently touched objects. Try to wear also could wear gloves to mitigate that exposure as well. So this is kind of where the program gets a little bit different from last year. Is now leisurely travel for unvaccinated employees. This is not really work-related travel. It's just leisurely travel if you want to go see family across state lines. Travel outside the state must have a PCR test within 3 days of returning to Vermont. Employees don't have to quarantine while we wait for a test. However, if symptoms arise, then we kind of trigger and you stay home. We've kind of been doing everything that we've done in the past. So that's just kind of the, if you report to health and safety that you're crossing state lines, just let us know. We could make sure you are all set with a 3-day test. Again, we'll just use the free pop-up test. Those tests are usually can get administered and get results in really between 36 hours. So once you're fully vaccinated, the guidance is you do not need to get tested following travel unless showing signs of infections. And if you have a close contact with a known positive, you do not need to self-quarantine for 7 days. So if you're fully vaccinated and you have a known close contact to a positive, you can remain at work just as we normally would in the past. Again, self-monitor. If signs of infections are popping up, then we need to, again, stay home if you're ill. Any future questions on the new program, please call me. Here's my number at any time. We can address any issues that might pop up regarding the coronavirus. Again, we are roughly 9 weeks away from that kind of target July 4th date, where hopefully we really see some further restrictions lifted. So we're really getting close. We just got to maintain our numbers, maintain our lines of communication. We're doing an excellent job. We just can't let our guard down this so late in the game. So this doesn't drag out any longer than it really needs to be. So again, just let's follow best practices. We're doing an excellent job, and just continue with the communication, because it's really saving us in the long run. With that said, I'll pass it over to Ken for the rest of our presentation this morning.
Okay, thanks, Matt. Yeah, we're all ready to get this behind us.
I agree.
So I'm gonna show my screen with the email of the week. Do you see it?
We do.
Okay, so Vermont forward, let's go, right? Forward.
Yep.
Okay, announcements. Congratulations to our newest ECI foreman. That's Troy Sheltra. So hopefully Troy's listening, and congratulations to you, Troy, and we'll hopefully see your success as a foreman, as well as what we've had from before your foreman. So we're excited about that, and I'm sure you are. Let's see, the 9-week holiday for premiums of the health insurance is continuing. And then we have a little bit more below on the ECI Primary Care Wellness Program, which is the official name for the wellness program, where we're helping to provide a wellness program that includes primary care. So you get to go to the doctor free of charge, even if you don't have insurance. There's advantages if you do have insurance, and there's advantages, lots of advantages, if you don't have insurance. I just want to highlight a few things in this document. I'll have available next week as well as a link, but the goals are to provide a healthy, productive, and happy workforce, to provide employees with access to basic health care, and to reward employees with the full benefits of this program if they participate in a meaningful effort to achieve good health. So it's all about it's all about wellness and getting, so you have a good health bill of health. And who is eligible and how? All full-time ECI employees are eligible. And you just need to start the program by making an appointment for a yearly comprehensive physical review at Champlain Medical. And the numbers there, all this is between the employee and Champlain Medical. We just are encouraging everyone to sign up. It makes a lot of sense, like I said, whether you're under a health care plan or not. And then the kind of the prize of the benefit isn't just getting the yearly physical, but it is kind of the acute care portion. So if you have an illness or get injured, you can go in and get free attention and a walk-in appointment too, which is handy versus making an appointment on acute care. So if you get injured or sick, something that happens that's different and not long-term, you know, there's that advantage and benefit to you, so that you don't have, you wouldn't get charged for your, you know, your deductible and everything if you are on an insurance program. If you're not on an insurance program, and certainly it is a great benefit even beyond. So just skipping down here a little bit, want to say that again, in the middle here, we have the yearly comprehensive physical and screenings are included, and it's age appropriate lab testing also. The walk-in acute care includes physical and mental and injuries. So you go into only, that's qualified only if it's a treatment that can be done at Champlain Medical. And then if you need some medication, Champlain Medical will assist you in preparing or getting the treatment that you need beyond them, or the prescriptions at a reduced price from what you might be paying without their assistance. And also they have referrals. If you do need services outside of Champlain Medical, that's an additional charge directly between you and the specialty provider. But referrals are needed to get to that point. So that is available for free from Champlain Medical. And then recommendations for preventative testing. An example that Beth has, if you have a smoking history, you can actually find out through a low dose CT scan of your lungs to see if there's any problems developing with cancer or anything. So this is a preventative testing. It's outside of CMUC, so it's not included in the free wellness program, but it is certainly available. The part that's more available is the referrals and getting the consultation from the doctor. So the scan itself would be a fee. And just re-emphasizing on what we want to let everyone know is that acute care is only available when entering the program with a yearly comprehensive review. So in order to get that, you've got to have that prearranged and prearrange it now and get that yearly physical out of the way. And then if there's any kind of program that that Champlain Medical sees that you should try to do in order to improve your health, if you have you know, pre-diabetes, or if you have maybe hypertension or something, they'll get you on a program. And then the idea is that you kind of have some meaningful effort towards staying on that program. And then you're eligible for acute care. So if you do need them for an injury or illness. So the other point is ECI doesn't know anything about your health issues here. It's only, we know if you're involved just through because of the billing purposes. And we and Champlain Medical will not be submitting any billing to the Cigna plan. If it is stuff that would be covered, or would be if you're paying out of pocket on anything on the extra services beyond Champlain Medical, that might be qualify as part of your deductible expense and everything if you're on a plan. But Champlain Medical isn't getting involved in the billing and allowing you to take that and have it as part of your deductible and have portions paid by your regular insurance. But probably if it's sent out, if you're sent outside of Champlain Medical, I would think that would be the case. And it's not for spouses and dependents, unfortunately. So we have a list of new employees, and we have, let's see, Adam Burrell. I don't know why this dark blue came into the background here. Andrew Jordan, we have quite a few people here. Brian Jenkins, Dustin Marchand, Michael Levick, Robert Kneebone, Scott Santor, and Vinny Gaudet. So Vinny's a returnee. Welcome to everybody. Hope to see you on a job soon. So we've got quite a few new people, so pretty excited to see that and certainly make them feel comfortable and get them introduced to others at ECI. So for the weather, there's no more complaining about a drought as far as I'm concerned. It's pretty, things seem pretty saturated out there, and it's going to continue throughout today and showers into early next week. So hopefully we'll get back on a nice track of sunny, mild weather that's good for construction work. Here are the links to the Vermont Forward and also the OSHA COVID directive. And then for the project this week, we're really just profiling paving in general, but this is at the I-89 crossovers for the Sharon Bridge. It is the starting week of the paving season, or the real full week of the paving season, with real production work going on. This is looking along where they're building the crossover to allow for the bridge construction to keep the traffic on the opposite bridge during construction. They're laying down a mat there. And then compaction. And the other interesting part about this particular job is that they're putting the new sidewalk machine to use. It looks like quite a fancy little unit compared to the old one. So you can control the screed and everything and dump right in from the truck. I guess maybe you use the skid steer. But pretty cool, and I guess it saves a lot of effort, a lot of handwork, so we're all for that. And then from the photo archives, this is back in, I thought I added that date. It was like September 2007, I believe. This is a City of Burlington project on Killarney Drive. So there's the old Barbara Green paver putting it down. So been a lot of pavement put through all our machines since then, that's for sure. So that's what I got. If you have any questions on the health, the wellness program, certainly check with me or Alberta or Matt or Bendal, and hopefully we can help you more. And also, I should say, check with Champlain Medical. So call up Champlain, make an appointment, and at the very least, you can get that baseline physical and get to know whether you have any issues with hypertension or prediabetes, like I say, or maybe something else that you may not notice or realize. So certainly that's probably the best way to go to start to find out about this program, is make an appointment. So that's what I got, Matt. I'll turn it over to you.
Yeah, thank you, Ken, and thank you to the 60 plus people we had on the call today. So appreciate the good participation. Let's keep it up. Let's keep working safe, keep COVID on our forefront, and communicate any situations they might have. And please let me know if you watched this with other employees so we can have a good account of attendance this morning. I'll have the recording up soon on YouTube for the ones that missed it. So be safe today. We'll talk soon.
Thanks, Matt.